Okay, good day everyone. Okay, today I'm gonna teach you some basic first aid knowledge. So this time we will learn how to apply a first aid if someone got a minor cuts or scrapes. So minor cuts and scrapes usually do not need a doctor's attention. However, proper care is needed to avoid infection. Follow this step to treat a minor cut or scrapes. Number 1. Rinse the wound thoroughly with running water to wash out any dirt and debris. 2. Apply direct pressure with a sterile cloth or gauze to stop the bleeding. 3. Apply antibiotic cream to prevent infections. 4. Cover the wound with a sterile gauze and adhesive tape or sterile bandage. Consult a doctor if the wound is red, swollen, tender warm, or draining fast. Now here is the video on how you can treat cuts and scrapes. How you can treat cuts and scrapes.
Cuts and grazes are common injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just the top layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating a cut, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Just put some pressure on there, and then raise the injury. Next, you need to clean the wound. And gently dry it. And finally, apply a sterile dressing. Just remove the gauze. Brilliant. Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or a graze.
Next, this is another way of how you can treat cuts and scrapes. This is the video number 2. Let's play it.
Sometimes the occasional graze or paper cut might happen when you least expect it. But what is the proper way to treat them? Let's find out. Step 1. Stop the bleeding. Use some gauze and apply direct pressure to the wound. Step 2. Wash it. Wash the wound under running water. Step 3. Clean it. Use an antiseptic cleaning solution to clean the wound. Step 4. Dress it up. Use a cotton bud and apply a thin layer of antiseptic cream over the wound, followed by covering it with either a plaster or some gauze and tape. Clean and dress the wound every day to make sure that it stays clean and uninfected.
Next, we will learn how we can apply first aid if someone got a nosebleed. Now, what is a nosebleed? So, a nosebleed When the blood vessels along the lining of the nose burst, either due to a blow to the nose or result of sneezing, picking, or blowing the nose. Follow these steps to treat nosebleeds. So number one, ask the person to sit up straight and lean forward. The person should not lie down or tilt the head backward. Ask the person to breathe through his mouth. Ask the patient to squeeze the soft part of his nose with his thumb and index finger for 5 minutes. Repeat the process if the bleeding continues. Consult a doctor if the bleeding continues for 15 minutes or more. So here are
With
some
nosebleeds,
videos on
most
how
of the
you
time they're
can
coming from the front part of your nose. In the
apply
front part of your nose, you have
nosebleed.
some blood vessels that sit right in the front, and when it's very dry out, just like the rest of your body, the skin gets very dry, the inside of your nose can get very dry as well. And so we have to take care of that and keep it from being dry. Oftentimes this is made worse when people are putting things in their nose, like fingers. And so we try real hard to get people to learn to not do that and also keep their nose nice and moisturized. You do want to make sure that if you are having persistent nosebleeds, and they're happening a lot, or they're very severe, or they take a long time to stop, that you want to talk to your pediatrician and potentially be seen by your nose and throat doctor to make sure that it's not something more complicated or severe. So we're going to show a quick example of what to do when you have a nosebleed that is actively bleeding. This is Heather and Ina, our example patient here. And what we're going to do is we're going to learn the right place to pinch your nose. And so what you want to find in the nose is you've got the top part of the nose, which is very bony. That is not the right place to compress. What you want to do is find really the bottom part of the nose where it's flexible and there's some cartilage, and you just take your fingers and you pinch like that. And if you hold the nose like that for several minutes, that's going to stop almost all nosebleeds. The other thing is you can teach the child to do that themselves. And Miss Ina and I have been working on it. So can you show us how you pinch your nose when you get a nosebleed? Good job. What I'm going to demonstrate now is one of the techniques for putting ointment into a child's nose. This is one of those things that we recommend with a child that's having nosebleeds happen frequently, that we do this on a nightly basis. And so one of the ways you can do this is the ointment that we'd like to use, Vaseline's one choice. This is actually an antibiotic ointment that we can use from time to time. What we do is we take a nice big piece of it onto a Q-tip, and all you do is take that and you put it into the child's nose, just a little bit on each side. And then the way that usually makes it work really well is if you just take that nostril again and you just pinch it like that. Now, you can take the rest of it and you can wipe it right away, and you've got enough in the nose that's going to help take care of most of the nosebleeds for a child. So if your child is having nosebleeds, you want to start with some of these very simple techniques. Certainly if it's something that lasts longer or seems like it's happening very frequently, you want to call your pediatrician and have them take a look.
Okay, another application on how you can stop the nosebleed.
First aid management of nosebleeds. In the event of a nosebleed at home or in the working environment involving children or adults, these are the steps to follow immediately. First, have the person sit up straight and lean forward slightly. Note, do not lie the person down or tilt the head backwards. Put on your gloves or other safety personal protective equipment as required. Fourth, with thumb and index finger, firmly pinch the bridge of the nose just below the bone up against the face. Apply pressure for 5 minutes. Time yourself as you do this. Reassess the bleeding after 5 minutes by releasing the pressure over the bridge of the nose. If the bleeding still persists after 5 minutes, place an ice pack covered with a towel on the bridge of the nose. Reassess after 5 minutes. If bleeding still continues after 5 minutes, call for an ambulance and repeat the process until the arrival of the ambulance.
Okay, and this is how we can apply first aid if someone got a minor cuts or scrapes or a nosebleed. You can apply first aid using these features. Hopefully you learn. Thank you and see you again next time. Goodbye.